Hey everyone, Assembly Member Nicole Malliotakis. Thank you for joining us this evening. I hope everyone is doing well and that you're home, you're safe. And certainly if you have loved ones that are affected and ill, I hope they are recovering and may God keep you safe, and I wish you all the best. I wanted to host a teletown hall today with someone who I respect very much and someone who's been very helpful over the last couple of weeks, and that is Dr. Sal Volpe. Dr. Volpe is the former president of the Richmond County Medical Society. He has 30 years of private practice experience. He specializes in pediatrics, geriatrics, also in internal medicine. And over the last couple of weeks, we've done a number of telephone town halls to individuals in my district, and they went really well. And many of the people who had questions were able to get answers on the telephone town halls. We cleared up a lot of confusion, gave some different advice on how people can protect themselves during this crisis. And I wanted to try this as a new format, a Facebook town hall. And so tonight we're here to answer questions you may have from a medical standpoint related to COVID and what you can be doing to protect yourself, care for your loved ones, particularly those who may have tested positive, how to deal with various issues and the precautions that you could be taking throughout the duration of this. I first want to start with just two updates. First, I wanted to say that today the governor announced that there are less hospitalizations, there are less ICU admissions, and there have been an increase in hospital discharges. And certainly, while we're far from being out of the woods, this is definitely good news, and it seems that we're moving in the right direction. The other thing is, on Friday, the State Department of Health updated its guidelines in terms of visitation. And this has been an ongoing struggle, and many of us have had to deal with individuals who were hospitalized, and for various reasons. First, it was a mother giving birth, and the father wasn't able to be present in the room, and we brought those concerns to the governor, and he addressed that and changed that directive. In addition to that, now we were dealing with a lot of people who had loved ones who were suffering in the hospital from COVID-19, and they were not able to be there for them. Now the governor and the state have changed the guidance on that and have directed hospitals to allow at least one support family member to be present in the last 24 hours of someone's life. And that, I think, is something very important that many people were seeking. And we're happy that finally, after advocacy from so many different corners of the state, that those guidelines have been updated so someone could be with their loved one as they are passing away. So without further ado, I want to turn it over to Dr. Volpe to just give a little bit of an introduction and any updates he may have, and before we jump into questions.
I want to say is I want to put a big shout out and thank you to everyone who is staying at home. You have essentially helped turn the tide for New York State and certainly for Staten Island. The next thing we need to do, just as religiously, is wear a mask. Wear that mask in public, even if you're just stepping outside. You never know when a friendly neighbor might be walking by or the post person. It's an opportunity to connect. So even though we're home, if you step outside, please put on that mask. We also want to put out a special shout out to everyone that's made it possible for everyone else to stay at home, the first responders, the healthcare workers, the support staff, the store owners, and certainly many, many more. Unfortunately, by this time, I'm sure most of us know at least of someone who has fallen very ill and possibly passed away. The good news, as the Assemblywoman pointed out, is that we've turned the corner in New York City. As the number of new COVID hospitalizations declines, the stress on the healthcare system declines. The stress on our fellow healthcare providers declines. There are going to be some tests available in our community that will help identify who has been infected. And the important thing to remember is, if you get the infection, 80% of the time, it's just a very bad flu-like illness. So that's the positive that we have to keep focusing on. There are now new approaches for the 20% who have to go into the hospital, new ways of delivering the oxygen that our bodies desperately need when we're ill. And the other thing that's very, very important, even though we've been told to stay at home, unless we have to be outside, most of the providers that I know, the healthcare providers, the mental health providers, are offering what's called televisits. And it could be as simple and old-fashioned as just picking up the phone, or it could be as sophisticated, if you like, as this Zoom teleconference is right now. So please contact your healthcare provider, be proactive, reach out to them, find out if they have a televisit. If you're not feeling well, you have any questions, reach out to them. They want to hear from you. And you may find that some of your doctors are actually being proactive and reaching out to you. It's part of an activity that we've been promoting. And so they're going to ask, how you doing at home? It's sort of like the friendly doc knocking on your front door and seeing how you're doing. Tell them how you're doing. If you have any concerns, let them know, especially mental health concerns. And that's my introduction.
Thank you, Dr. Volpe. During the telephone town halls that we held, we got a lot of questions about what precautions people can take at home. And more we're finding individuals who do have a loved one who has tested positive within their household. So I was wondering if you could start off by talking a little bit about some of the precautions people should be taking at home if they have a loved one who has tested positive for COVID-19.
First thing, be hopeful. Remember, 80% of the time, that person will get through their illness in the next 7 to 10 days. While that person is at the house, they should have their own bedroom, ideally. They should have their own hamper. When food is being brought to them or you're interacting with them, both of you should be wearing a mask. If it's not too cold outside, crack open a window a little bit. Improving the circulation in the room will increase the safety for both of you. If you have an air conditioner that can run, that's also useful. The key thing is circulating the air in the room, reducing contact with that individual. Any clothing in that hamper has to be washed separately. Ideally, it would be in a bag that would then just be thrown away. And then again, when you bring it back to that individual, you should be wearing gloves as you're providing it into that person's bedroom. They can eat everything that we eat. There's no food restrictions. But the key thing is decreasing your interaction with anything they've touched. Just wash your hands. The most important rule is wash your hands. And I usually remind people, you wash your hands for 20 seconds. You should also rinse off your face. Wash off your face, because the main way that we get infected is not through our hands. The reason why we're washing our hands is so that we don't infect ourselves through our nose, eyes, and mouth. So the odds are that 6 to 10 times an hour you're touching your face, so you might as well wash your face if you're washing your hands.
Doc, so many of us have pets. As a matter of fact, I'm here with my Chihuahua Peanut. And for those of us who are animal lovers, for those of us who do have dogs and cats, I know there are certain precautions we should be taking. A lot of people have read about the tiger that tested positive at the Bronx Zoo. Can animals, pets, transmit the virus? And if we do have a COVID positive patient in our household, how do we handle pets?
Great question. So there have been no documented cases of a household pet transmitting the virus to a human. So yes, our dogs could catch the virus, our cats.
I don't know if we lost the doc here.
We connected?
There you are.
Sorry. All right. The key thing to remember is our pets won't transmit it to us. But if you have someone in your household that does have COVID positivity, please restrict access of that animal to that person, because some of the COVID you should restrict your exposure to the animal. If you, of course, want to pet the animal, then it makes sense to wash your hands before and after. And the same thing with the individual who'd be sharing a house with you.
Gail has a question about cases on Staten Island. And she's wondering if that we have less cases or if the number has been decreasing. I know that in terms of hospitalization, at least with Staten Island University Hospital, which we had gotten some information earlier, that it sort of had flattened out and they're seeing less hospitalization. So what the governor was saying earlier today, where hospitalizations have seemed to plateaued a bit, that is the case here on Staten Island. Doc, do you have any other information you'd like to share with Gail and the others?
So you've given the good news part. The number of hospitalizations are down. What is interesting, however, about Staten Island, and it may be a reflection of the number of civil servants that we have on Staten Island, is the proportion of individuals per 100,000 that are positive is higher than some of the other boroughs. And so it may just be that based on the type of profession, whether one's a fireman, a policewoman, a nurse, or a doctor, since they're more likely to be in contact with individuals with COVID, they're more likely to come back positive. And since many of them do live on Staten Island, that's possibly where those numbers are coming from.
Bob Romero wants to know, he's just gotten over COVID-19 and he wants to know if he is now immune.
Well, the best way to find out is with a blood test. However, different SARS viruses in the past have shown us that once you get the infection, everyone apparently does develop antibodies and develops immunity. This is what they call novel or new infection. So there may be some difference in the percentage of people who convert to make antibodies. But it does appear that we're hopeful that yes, the majority of the people, if not everyone, will become positive with antibodies. And I might just use this as a good segue to say that the Red Cross is actually accepting people who want to donate their plasma, assuming that they have antibodies, because that plasma can then be used to treat people who are severely ill. Because your plasma will have those antibodies, the antibodies destroy the virus.
Doc, one of the other questions we received a lot of is with regards to packages and mail. How can we ensure that any packages coming to our home or mail coming into our home does not have the virus on the surface? I read somewhere that it is up to 24 hours that it can remain on cardboard. So I was wondering if you had any suggestions regarding that.
Good question. So what we have been advising people, assuming that you have the space for it initially, is to set up a small table by the front door. Everything that comes from the outside should land on the door. And then what I did was, following from one of the other medical commentators, I put a piece of tape to separate the table between dirty and clean. So everything from the outside goes on my left-hand side. And then as it's being opened, it gets transferred to the right, which is the clean side. Some people will spray the packages with a weak bleach solution, which you can get the formula for from the CDC website. Some people spray it with a disinfectant. But the key thing is anything from the outside should not be brought in to your kitchen table, should not be put out on your countertop. It needs to be isolated. You open it, you take out the contents, and since you are touching material that could be contaminated, you always have to wash your hands afterwards.
And what about groceries? Another question that people are curious about, or two things. One is, with your groceries, particularly vegetables, is there anything special that you need to do to make sure that they are washed properly? And I guess the other question is, which I was actually curious about, is money. Can money hold the virus? Coins, dollar bills, and is there a precaution that you should be taking there as well?
Very good. So if you have a food that's in a can or something, many people just recommend you just wipe it down. Again, you take your groceries from the outside. Left-hand side is the dirty side. As it's being transferred, actually I have a system with my son. I pass it off to him. He's wiping it down, and it's going into the house. As far as fresh fruits and vegetables, it has always been the recommendation of the USDA to wash them down just with fresh water. That's more than adequate to keep them clean. The packaging you could wipe down, but the unpackaged fresh fruits and vegetables, just rinse them off. As far as money, you bring up a good point. Money is dirty. Whether you look at it from a philosophical or a medical point of view, can be dirty. So just assume that it's always been dirty. It's always had E. coli and all sorts of interesting bugs on it. Except now we're concerned about COVID-19. So if you can, limit the amount of exchange you do with money. So if you can use cashless type exchange with a credit card, great. If you can't and you're going to accept change backwards, you might just get in the habit of saying, all the change I get backwards, I'm picking on my left-hand side for some reason, I would put it in my left-hand pocket, all right? So clean money in my wallet or my purse or in my right hand, dirty money goes in the left. You take it out, put it on that table, wash your hands. At the end of the week, you'll have a nice little fund of money that you could use. What we also do, quite frankly, is we round everything up, especially in these trying times with supermarkets and small stores and restaurants. If you were eating in a restaurant, you'd be given anywhere from an 18 to 25% tip. So if you can afford it, I'm not saying you have to, but if you could, just round it up and say, just keep the change. If you can't, put it in that left-hand side.
You could spray it with Lysol. I mean,
absolutely. And on that table, that would be your disinfectant area. So as you spray your mail, you're spraying your $1 bills and $5 bills and quarters and 50-cent pieces.
Jenny Lynn asked if we should expect to see another wave of this virus or infections, and if so, when do you think that may happen?
Until everyone is infected with the virus, you can expect a resurgence of the virus. That is why right now, while we are at a plateau on hospitalizations and a significant decrease in new people being admitted to the hospital, we have to stay vigilant because there are a lot of people in the community who have not caught the disease yet. So what will happen is, as we find more and more people get the infection and then resolve 80% of the time, eventually we're going to start loosening the homebound restrictions that we have. As that gets reduced, some people will get the infection. When can that happen? Probably 2 to 3 months from now. It all depends on whether the restrictions go beyond April 30th, May 30th. It'll probably be several months thereafter. But the good news is, in the next few months, there'll be more and more testing being done in the community. So we'll be able to know which people have had the infection, which haven't, so that when you go to your workplace, people might voluntarily acknowledge it, and then some people who haven't had the infection could be more guarded than those who have had the infection.
Kara's asking if the loss of taste and smell is enough for a diagnosis. We know that has become one of the more common symptoms.
Yeah.
And maybe you could explain a little bit why people would lose their sense of smell and taste.
Sure. That's a great question. And when it was first brought up, I know there were a lot of medical people who were not impressed by it as a symptom. But it is a very common symptom for these types of viruses. They attack our airways, and they love to beat up on those cells in our nose that help us smell. And in case you didn't know, smell accounts for about 80% of your sense of taste. So if you lose your sense of smell, your taste ability drops also. So that's how that connected. It's not really beating up on your taste buds. It's really beating up on your sense of smell. So these viruses, and the novel coronavirus isn't the only one that does this, beats up on those cells. And there are some really great studies going on. Actually, my son was just invited to participate in one of these studies, where what they're doing is they're going to ask people that come into the hospital, tell us about your sense of taste and smell, when did you lose it? And they're also going to start contacting individuals who have been discharged. So there's not just here in New York City, but all around the world, the idea of anything that can give us a little bit of insight on when these symptoms occur. Because remember, 80% don't go to the hospital, And many individuals are what they call asymptomatic, only mildly ill, but they might still have this loss of sense of smell.
Doc, Stephen is commenting that his mom and dad are both 89 years old, and today they were exposed to COVID-19. The mom is bedridden, the dad has a pacemaker, and he's asking what his options may be. And first, let me say, Stephen, we hope your parents get better as quickly as possible. But Doc, would you like to comment on what his options are?
Sure. Again, please accept my feelings of support for you, because this is a very stressful time for the three of you. The first thing is always contact the healthcare provider, whether it's a physician or nurse practitioner who's taking care of your parents. So I'm assuming that they were tested. So some healthcare provider was probably involved at some point, and they will help you understand what's going on. Remember, the advice about contact with the COVID individual is the same advice we gave about 10, 15 minutes ago. So as you try to help your mom and your dad, wear the gloves, wear the mask, wash your hands, and look for symptoms that tell you that maybe they may not be doing as well. And those symptoms are, increasing shortness of breath, a persistent fever, chest pain, or a change in what's called the sensorium. They don't seem to understand you as you're speaking, that their ability to connect with you seems to be handicapped. These are some of the warning signs, especially if they turn bluish. That means they're not getting enough oxygen. But step number one, talk to your doctor. Each of your parents has a profile of illnesses and comorbidities and issues that your doctor and their doctor would be most sensitive to and can alert you.
Thank you. Gina is asking if you think that the virus is airborne.
All right, great question, Gina. There are lots of studies out there now that look at what happens when a person sneezes and coughs. Now, initially they felt that the virus was pretty big and would kind of just attach itself to droplets and fall off relatively quickly. There are some increasing studies where they sampled different surfaces throughout the room, and they're finding COVID on those surfaces. Now, it doesn't mean that they're live viruses. It just means that they found COVID. So they found RNA, but it may not have been a live virus. So it's very important to remember. Just recently over the weekend, CDC shared some information from China, which showed that the radius isn't just 6 feet, but may perhaps be as much as 13 feet. And that would go more with an airborne sort of contagion. So the best thing is wear the mask. We're going to have, I believe, Assemblywoman is going to have on the website simple advice, instructions on how to make your own mask. You don't have to know how to sew. You just have to get a rectangular piece of fabric. And in some cases, some of them are actually advising putting in a coffee filter, believe it or not. That increases the efficiency of the mask. But even without the coffee filter, it is very, very good. So yes, more and more people are believing that there's an airborne component to the COVID.
Well, obviously, mental health is certainly impacted during a time like this, and many people are feeling stress, they're feeling anxiety, they're feeling depressed. Some may have lost a loved one, others may have lost their job. So can you talk a little bit about the importance of keeping your mental health checked, getting exercise? And I know that the state, if I could just drop the phone number, the state has put together a hotline where we have thousands of volunteers who have mental health professionals who have volunteered to talk with people who feel that they need someone to talk to. And, again, feelings of anxiety, stress, isolation. And that number is 1-844-863-9314. Again, 844-863-9314. Dr. Volpe, would you like to add?
Yes, ma'am. Thank you for sharing that New York State number. I'll share a New York City number for everyone. It's 1-888-NYC-WELL. 1-888-NYC-WELL. And you could either talk to someone, chat with someone, or text with someone 24/7. So between the state and the city, we have literally tens of thousands of individuals that care and want to help. But to the Assemblywoman's point, just because we're at home doesn't mean we can't connect with others. Whether it is the old-fashioned phone that I grew up with, whether it is using a smartphone that has all these different capabilities between Zoom and FaceTime and Skype, I think what's really important for us all is the ability to connect. And sometimes a voice is just enough. Sometimes it's not enough, but for most of us, it may be enough. The other thing that the Assemblywoman was very prudent to recommend is exercise. So many different websites, whether on the Assemblywoman site or on the Staten Island PPS, which is where I work, many sites offer free exercise information. And it could be something as simple as walking up and down the flight of stairs in your home, doing several circuits around your dining room table. If you're lucky enough to have a home, walk outside. We call it walk up and down the steps of your stoop, which is the steps to your front door. If you have a backyard, walk around the backyard, wear that mask. You go outside, you wear that mask. But the key thing is to be active. If we become sedentary, which means just to sit in a chair or sit on the couch or lay in bed, not only does it make us physically weaker, but it is not good for our state of being in terms of how we feel. Do not be afraid to reach out. In fact, one of the things we did at the PPS is we encouraged everyone to reach out to 5 other individuals for the next 30 days. So reach out. Reach out to people you haven't spoken to in a year, 2 years, 10 years. If you got Facebook, reach out to all the people you've been meaning to and haven't gotten a chance to. So connections are important. Exercise, Assemblywoman, very, very important.
Susie Q is asking about patients struggling with cytokine storm. What is that and why does it happen?
All right, the cytokine storm, or cytokine storm, is something that happens in a lot of different types of infections. And it relates to the production of these chemicals called cytokines, which, when they're at the right levels, help us deal with infection. But when they increase in quantity, when we produce more than we need, then there is a cascade of terrible things that can happen. It can affect the lining of our airways. So the tubing start making more mucus, more fluid. The alveoli, the little bags in our lungs that hold on to the oxygen and exchange it with the blood vessels, they get inflamed. They get filled with fluid. Our blood vessels can get inflamed, and that's why we're at increased risk for something that looks like a vasculitis. There's an increased risk of what's called thrombosis, which would be like clots, which could occur in your legs and elsewhere. And these cytokines affect many of the tissues in your body. So it could be your heart, your kidneys, your liver. And again, it's an inflammatory response. And what's interesting is that it seems to be the macrophages, which is a certain type of cell, which normally likes to gobble up things, seems to be making a lot of these cytokines. And the white blood cells that normally we associate with fighting viruses, the T cells, the T8 and the T4, actually decrease in number. So even though they also can make cytokines, it's actually cells other than these lymphocytes, which again, like I said, drop down significantly, which are contributing to the cytokine storm. And that's why some people are running different studies to see what they can do. And some of the studies are give an anti-inflammatory like corticosteroids. And some people are looking at hydroxychloroquine, which is used in lupus. It could be used in rheumatoid arthritis, originally used to fight malaria. So no one knows yet which of these are the best. The best way to find out is in a scientific study so that we can identify which people would benefit from these medications and also which dose, because the doses could vary depending on the individual.
You mentioned hydroxychloroquine, and that is something we're hearing a lot about these days. I know here in the state of New York, the governor was only allowing it in inpatient hospital settings. The local elected officials had really pushed him to expand that to nursing homes. And really, people would like to know, why it's not being prescribed or being allowed to be prescribed by regular doctors to their patients. And can you maybe talk a little bit about where it is in this clinical trial and what are some of the reasons why they would not prescribe this drug or allow doctors to prescribe it?
Sure. It is not uncommon for physicians, nurse practitioners, PAs, to prescribe something off-label, which means when a medication is created and submitted to the FDA, they have to say, what are we going to use it for? So they may give, let's say, 10 different indications. This would be an off-label indication. So what does that mean? That means no one really knows what's the right dose. No one really knows what happens when a person with COVID gets exposed to hydroxychloroquine. There are examples, but it's not until you test many, many people that you can really start identifying what's going on. Because you can't tell whether or not it was just a random event or something that made a difference. Hydroxychloroquine, excellent drug, has saved probably millions of people with malaria, has reduced the pain and suffering of many people with lupus and rheumatoid arthritis. But it's not without risk. It can affect your heart. And in some people can affect the way the heart rhythm works. So if you have someone who has an unknown cardiac issue because you may have had an EKG and at that time it was great, but you may be susceptible to an arrhythmia or an abnormal rhythm when being exposed to hydroxychloroquine, you wouldn't know that until you were given it. And the best way to really decide whether or not this makes a difference is in a controlled study. And right now, there aren't significant controlled studies in the ambulatory environment, outpatient environment. Most of them on the inpatient side. But when they expand it to the outpatient, then the doctor, your healthcare provider, can enroll you in one of those programs. So some people are saying, why not take it prophylactically? Just in case. Be part of the study so that you can contribute all the information to it.
Thank you, Doctor. Leo Leonardo is asking who is being placed at South Beach Psych Center, which is the expansion of the Staten Island University Hospital, and how are local hospitals and nursing homes doing with supplies? This is a question that I can answer. South Beach Psych began taking patients a week ago, Monday, a week ago. And they have been taking patients who are either pre or post ICU. So they're leaving those who need ventilators. They're leaving those individuals in the hospital setting in ICU. And then they're moving either the pre or the post patients that are COVID positive to the South Beach psych site. And of course, that would relieve a lot of pressure on our local hospitals. And so that's currently happening. In terms of supplies, at the beginning, there were issues with supplies and nurses not having, nursing homes and hospitals not having adequate N95 masks and proper supplies, which was horrific. As well as our first responders. And so many of us had to do collections. We had to look alternatively because the city was not providing a steady stream. The city since has provided more of a steady stream of equipment and supplies to not only our first responders, like our firefighters and our police officers, but they've also done so for our hospitals and our nursing homes. I've actually worked with many people to put together supplies, whether it be gloves, whether it be N95 masks, whether it be sanitizer, to get those out to the organizations that had been lacking, and medical gowns, for example, in our group homes. That was another big problem. So we were able to gather supplies and distribute to fill the void where the city wasn't providing that steady stream. I will tell you that the needs seem to have been shifting now, and now they're looking for face shields. So I'm working to try to get an adequate supply of face shields to Staten Island for our nursing homes and to the Brooklyn part of my district as well. And we just dropped off about 500 to Richmond University Medical Center last week. We're expecting to get more later this week, where we will have enough to cover all the local hospitals and all the local nursing homes. And that will be very, very good. But it's been rough because these supplies are coming from overseas. If you're ordering them, it's difficulty coming directly to New York. So these supplies actually went to Florida, are now making their way to New York, where we hope to have them by the end of the week to provide proper protection for our healthcare workers, our frontline workers. So that's been the struggle in terms of the supplies. I'm glad to see that the city is now providing the necessary supplies for its first responders and its city workers. But that in itself has been a struggle. And as you know, I wrote an op-ed in the Advance a couple of weeks ago saying how the city essential workers need to have the proper protection. And I was calling out the mayor and doing that. Also, you should know that the delegation, all the elected officials, we signed a letter to the mayor calling for extra staffing, particularly with the opening of the South Beach psych site. There was an issue of having adequate staffing, adequate nurses. And so we've been, it's been positive discussions with the mayor. We're hoping to get some relief for the hospitals that we do have here on Staten Island, and also ensuring that we're also going to get testing for the healthcare workers. I mean, this is something that we've been saying for a long time. You have these hospital workers, they need to be tested for this virus to make sure they're not spreading it to coworkers or others within their environment, their families at home. And so the mayor announced that they were going to do testing, free testing for healthcare workers in the other boroughs that have public hospitals, but not for those at private hospitals. And we don't think that's right. And so we're pushing and advocating for that as well. We hope to hear back soon. Doc, let's see. We have another question. Does warmer, sunny days help contain the virus?
I haven't seen any studies that support that. As you know, when you look around the world where COVID is present, some of those places are warmer than New York City is, and they have COVID in Florida, and Florida is a bit warmer than it is here. So while traditionally the coronaviruses tend to wane as spring and summer comes in, we're not sure what's going to happen with this virus. And the other thing to remember is we live in an international world now, right? So as the numbers, as we get warmer, then people who may have been exposed to coronavirus elsewhere in the world, when they interact with other parts of the world, which may be warmer than they are, can also, again, help spread this disease. So the key thing is, I think the take home is, it would be nice if it helped. I'm not sure it will, but we'll keep our fingers crossed.
Someone just asked if we will be getting the 5-minute testing here on Staten Island, so that way you don't have to wait 3 days. Well, certainly there have been some scientific breakthroughs here in terms of increasing or shortening, I should say, the time period it takes to get results. It started off being close to a week, and then 3 days, and then 24 hours, and now we're looking at rapid testing where you can get it within just minutes. Staten Island University, Richmond University Medical Center was approved for the rapid testing a couple of weeks ago. Still waiting on the manufacturers before they can do it regularly, and that's the answer to that question. I don't know, Dr. Volpe, if you have any other insight into rapid testing in general?
Sure, thank you. The thing to remember is there are many different tests out there. So the tests that have been requiring several days to get results are these PCR tests. And the PCR test, what it does is it actually takes a little piece of the RNA from the virus, multiplies it, and then has a way of measuring it. So if you have the virus in your body, and they can detect it through this nasopharyngeal swab, which is a not necessarily pleasant way of getting a specimen, but is one of the best ways. So if they get a specimen, goes through your nose, goes down the back, kind of tickles the back of your throat a little bit. It actually takes that, looks at the RNA of that virus and says, yes, the virus is in this person. No, it is not. These fast turnaround tests can turn around because they're not waiting for the machine to multiply the RNA. What they're doing is actually measuring your antibodies, your response to this virus. And we make two different types of antibodies. We make an IgM and an IgG. And the IgG takes a few more days to pop up. The IgM is the first thing you make, then IgG. If you have enough of this IgG, the test can identify it. There is some risk of false positives because if you were exposed to a corona virus that was similar to the novel virus within a couple of years, you would have antibodies. So it could throw it off. The other thing is it might miss the antibodies in your system. So I think it's a great way to at least begin assessing the number of people who have antibodies, but the tests are getting better and better and better. So the short answer is we'll take the tests as they come along, hoping that they refine them, but the PCR test is the one that we traditionally have to wait the longest for, but actually measures the virus itself.
Kimberly is asking, it's interesting, Doc, because a lot of people are feeling the symptoms differently. And obviously this virus is hitting people in so many different ways in terms of severity, in terms of the different symptoms that people could experience, in terms of the length of time it takes to actually develop symptoms. Yep. So one question here from Kimberly is, can COVID get worse even though you don't have a fever? So, I mean, could you experience severe symptoms in terms of chest pain, in terms of shortness of breath, without having the fever that would go with a viral infection?
Generally, you will produce a fever if you've got a strong infection. There are exceptions, however. So if you are an older individual, so you can see how much gray I've got on my face and the top of my head. So people who are somewhat older than I am, older individuals don't necessarily produce high fever, nor do children sometimes. So while fever is very important, it's not the only thing to track. So again, if you're short of breath, if you have chest pain, but you don't have a fever, you might still have COVID. You may also have something else. You could be having a heart attack. So one of the things that we need to remember is the things that have been happening to us all along before January continue to happen. So chest pain and shortness of breath is also associated with heart attack. It's also associated with clots in our lungs. But when we're talking about COVID and we're talking about not the very old or the very young, there's usually a fever associated with it.
Thank you. And Nancy, speaking of symptoms, Nancy Roden is asking about the shortness of breath. I was watching an interview this morning on Fox 5 with a doctor who had just recovered from COVID-19, and he was saying that he had one of those oxygen monitors, and he was testing himself because he knew once the oxygen got below a certain point, he would have to go to the hospital. He had said if the oxygen level gets below 90, then that's probably when you should be going to the hospital. I don't know if you agree with that or if you can comment on that as well. Sure. But what are some other things you may be able to do at home to help your breathing should you feel shortness of breath, but you're not sure you're at the point where you should be going to the hospital?
Well, we'll start with, do you have a history of asthma? Do you have a history of COPD? Are you a smoker? Again, just as heart attacks will continue through COVID, people can still have a conventional asthma attack. So if you have asthma, you should be using your inhaler. People with asthma often have what's called a peak flow meter in their home. Peak flow meter is a tube that lets you identify how much air you can push out in a short period of time. So if you're an asthmatic or a COPD who has a peak flow meter, that's another way to assess what's going on with you. If you don't have a history of asthma or COPD, but have a history of high cholesterol, again, there's that risk of that heart attack. So from my point of view, if you've been having shortness of breath that's lasted several hours, well, you should be calling your doc. And if it's very short of breath that you can't hold your breath for 10 seconds, that it is that severe, well, then you should call your doc, but also consider calling 911 if the pain or the shortness of breath seems unbearable. But again, you shouldn't let it get that far. So I'm assuming that someone's had some shortness of breath and it's beginning to worsen. Well, you should have called your healthcare provider beforehand. And the good thing is, if you call 311, they will help connect you with a doctor even if you don't have one. I believe that's a service that's being run through health and hospitals. But also, many of the doctors on Staten Island are, through televisits, taking care of patients. Point about the 90% oxygen, that's a kind of a tricky question, because what happens is, I'm going to try and draw an S on the screen for those of you who can see it. And if you think of an S, it's got a flat top at the bottom, a flat part at the bottom, flat top, top, and then it's got this diagonal that goes along the side. You know, when you're in the mid 90s to high 90s, you're in the level area. But as you get closer and closer to 90, it starts getting tricky, because very soon it drops. So while the physician may have felt comfortable monitoring himself or herself, I would not recommend that for the layperson unless they've spoken to their healthcare provider, because again, we're all different. Some people because of their lung history, but an average person should be in the high 90s.
Chris is asking if he has symptoms and he quarantines for 14 days. Is that enough time to now go out and visit his elderly parents? He says that he can't make the distinction between symptoms of allergies and COVID. He's not sure what his symptoms are exactly, but he's been in quarantine for 14 days. Can he go visit his parents?
Again, a very fair question, and I completely empathize with your desire to be with your parents, support your parents, and help your parents. But you have to do this very cautiously. So in general, I'm assuming that you weren't tested as positive and it's just you began to have symptoms. Generally, if you've had a fever during these symptoms, you have to be fever-free for at least 3 days. 72 hours, no fever. And the cough and shortness of breath have to have been resolved. And the last thing is, it has to be at least 7 days since your symptoms first presented themselves. So the tricky thing there is, if you have a history of hay fever, each day kind of feels the same. You wake up with the stuffy nose, you have to blow your nose, you may take your antihistamine. So you may not be sure when that first day is. And 7 days minimum from when you think it could have occurred. The other thing that I need to mention is, and I've been repeating myself because the health providers probably the Assemblywoman mentioned that I'm also a geriatrician, and that's a person who takes care of the elderly. And we have always brought in the children or nephews and nieces or anyone else that's been a caregiver for an elderly person. So I would encourage you to, when you speak to your doctor, and also speak to your parents' physician to see when he or she feels that it's appropriate to reach out to them.
Joan is asking a question about social distancing, and this will be the last question of the evening. And her question is, even if you're social distancing, should you still be wearing a face covering? She feels like she's getting mixed messages And by the way, I did post on the comment section the homemade masks. If you are going out, and you should be covering your face. And let me just also say that with regards to those people using public transportation, I believe and others believe, and the commuters have written to me saying they believe that people that are using public transportation, that are using the buses and the subways, should be required to cover their face. They may not have to use a mask, but at least a scarf, a handkerchief, or something to cover their nose and their mouth. So the question is, even if you're social distancing, you are staying 6 feet apart, should you be covering your face?
All right, so as we mentioned earlier in this conversation, 6 feet may not be enough anymore. It may be 13 feet. What if it's 14 feet? The best thing, quite frankly, is to wear the mask. Especially the one that's on the website is, other than having to cover your face, it's not really that uncomfortable. Doesn't really restrict the airflow significantly, but will keep you, the person wearing the mask, from making the other person potentially ill. So we normally think of protecting ourselves, but here the responsibility is to protect someone else. And there are many cultures where as soon as you feel that you're ill, one of the first things you do as a responsible member of the community is to cover that face. So until we really have a great sense of whether 6 feet, 12 feet, 13 feet is better, I suggest wear the mask and wash it every day. I recommend usually making several so that you can cycle these on a regular basis instead of being tempted and using them more than one day at a time.
Thank you, Doc. And on that note, I will just conclude by saying today, Councilman Stephen Matteo and I wrote a letter to the MTA urging them, because they had reduced the bus schedule to a Sunday schedule. So there's only 4 bus lines running from 23. Now it's down to 4 lines only running on a Sunday schedule. And so the buses this morning were a bit crowded. And that is really a major issue, not only from the social distancing standpoint, but the fact that, there's been a lack of service. So we've written to the MTA asking them to reassess the entire situation, to add more frequency, so that way people won't be sitting on top of each other and the bus will be jam-packed, but also to require that there be face coverings when boarding a bus or coming onto the subway. And that's for the well-being of everyone during this time. Again, it may not be a mask, it could be something homemade, but it's really important that everyone just cover their mouths, particularly when they're using a public transit system like that. So I want to thank everyone who participated today and asked questions. We tried to answer as many as possible during the time allotted. You can feel free to continue to comment and ask questions, and we'll try to get answers for those that we were unable to answer up until now. Dr. Volpe, thank you again so much for lending your expertise, for speaking to the community. It's not just Staten Island and not just Brooklyn. It's probably all of New York City and the state that's participating in this call, and maybe even people in other states. And so, a lot of people have questions, a lot of concerns, and rightfully so. So we thank you very much. And my office continues to be open. We continue to help people with various concerns and issues. So feel free to give us a call, and we're happy to help you. You can send me a private message as well. But I hope everyone stays healthy and safe, and hope to see you out in the community really soon.
Thank you for this opportunity. Thank you.
Thanks.